In this video, I want to help you learn how to stabilize your spine into a neutral posture while working on your hip flexibility, particularly your inner thigh, and activating your deep hip soft tissue so that for rotation of the hip joint. Let's sit on a bolster, rolled up yoga mat, some AirX pads, pillows, whatever you need to use to get your hips off the ground, and it will open up this space here so that you don't have so much compression in that front top of the hip joint. That is where people get most arthritis. So you don't want to impinge any of that or create any discomfort. So if you can, you want to have your lower back muscles touching the wall, your middle back between your shoulder blades. See how I'm shifting? I'm shifting my shoulder blades back. And you want the back of your head back against the wall. So sometimes just sitting in this position and breathing, working on our expansive breathing in this position, is challenging for people, especially if you have a lot of upper back tightness. But we are going to work on our hips in this posture. So you do want to hold this as much as possible, but also make sure that you're comfortable to hold the stretch. You want to work on finding the stretch of those inner thighs. If it's too much to still have the legs laying out to the side here, as I am, this is when you can maybe use some pillows or towels rolled up, something soft that you could push into. I'm going to use my hands to press down on the insides of my knee to create the stretch along that inner thigh. If you need to, you can use the yoga block. You can press down on that yoga block to assist you. That way you're not creating strain anywhere else, because remember, we want to be able to hold this for 2 minutes. So let's do 4 breaths here. We're going to take a nice deep breath in for a count of 4. Out for a count of 8. Move into the stretch as you tolerate. Take a breath in. All the way out. You can also think about sinking your tailbone into the ground and try not to allow your lower back to arch off of the wall. Another breath in. All the way out. If you need to shift your hips back to the wall again, feel free to do so. One more breath in. And all the way out. So, now that we're finishing our passive stretch, we don't want to move out of this position that we are in our end range. We're going to move into our pails and rails. Let's work on 60% capacity. Since we have to modify for our spinal position and things like that, working at a lesser intensity for just a little bit longer instead of our 3-second maximum holds allows you to have a little bit more control and to ease into the more challenging trainings. Now, our pails are passive tissue. You're going to be contracting the tissue on the inside of the hip here. Think about the front of that joint here, deep. You're going to try to contract that tissue with the experience of trying to rotate the thigh kind of forward to you, okay? So let's take a nice deep breath in. Hold that in your abdomen, create 60% tension throughout your whole body, and 60% of your effort, try to contract the front of that joint. 2, 3, 4, 5, 6, 7, 8, 9, 10. Our rails are regressive tissues, the shortened tissue in the back. Take a nice deep breath in. Anchor that in your abdomen. 60% tension throughout the rest of your body. And now contract the back of the hip. You're trying to turn the thigh backward. Good. 3, 4, 5, 6, 7, 8, 9, 10. All right, let's move into 2 more sets of those. Breath in. Tension throughout your body, 60%. Contract the front of this hip joint tissue deep in there, trying to rotate the thigh in the joint itself. 5, 6, 7, 8, 9, 10. Let's move into the regressive tissue, the back of the hip. Take a breath in. Anchor that breath. 60% tension. Contract the back. Try to rotate that thigh backwards. 4, 5, 6, 7, 8, 9, 10. Okay, again, just a reminder, you want to make sure your lower back muscles, in between your shoulder blades, the back of your head, this is your base position. Nothing's moving. It shouldn't be coming off the wall at all. Let's do the pails. Take a breath in. Anchor that tension, 60%. Contract the front of the hip joint. Try to isolate that experience right here. I can feel mine switching back and forth. The back of that hip really wants to do the work, but we want to concentrate to the front of that joint capsule. 5, 6, 7, 8, 9, 10. Okay? And now the back. Take a breath in. Set that tension and contract the back of that hip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. All right, so we're going to work on the other side. If you have your yoga block there, you don't need to remove it. I don't need the yoga block. I was just keeping it there for visual, and I'm going to just remove it so I can talk through the hip here as we're going. So let's work on our pails. Same thing on this side. Just think about concentrating in the front of the hip joint, you experiencing that tissue contracting. Take a deep breath in. Anchor that breath. 60% tension throughout your body and try to contract just the front of the hip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now we're going to work on the back. Take a breath in. 60% tension throughout and contract the back of the hip. Try to rotate that thigh backwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, pails, take a breath in. Set that tension throughout. Front of that hip joint, contract it. 1, 2, 3, 4. My body's trying to figure it out. It's good learning. 6, 7, 8, 9, 10. Right? Our rails, regressive tissue, the back of the hip. Take a breath in. Anchor that 60% tension to the rest of your body and contract the back of the hip joint. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, last one. Pails, here we go. Take a breath in. Make it your best. 60% tension throughout. Don't let that tension go, and contract the front of that hip joint. 1, ooh, that's already better. 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, last one, back of the hip, regressive tissue. Take a breath in. Anchor 60% throughout your body and try to rotate that thigh back. 2, 3, 4, 5, 6, 7, 8, 9, 10. Great job.